We seem to have crisis du jour, but many of the crises we face are transitory. But there is another crisis in the making that will have long-term effects upon the country. George Barna is here to discuss Millennials in America, new insight into the generation of growing influence. That's coming up later here on Washington Watch. The website, TonyPerkins.com, lots of resources there for you on the website. And from coast to coast, border to border, pray together for life. Sunday, November the 28th, we'll be gathering for a national prayer event in Jackson, Mississippi, in advance of the U.S. Supreme Court hearing on the Dobbs versus Jackson Women's Health Organization case. This is the case that could overturn Roe v. Wade, the Supreme Court decision that made abortion legal in all 50 states. To find out how you can be a part of this historic prayer gathering on Sunday night, November the 28th, text the word TOGETHER to 67742. That's the word TOGETHER to 67742. As I mentioned, the Occupational Safe and Health Administration, OSHA, has suspended activities related to the implementation and enforcement of its COVID shot or test requirement for private businesses in response to the order by the Fifth Circuit Court of Appeals. But it also added that, quote, OSHA remains confident in its authority to protect workers in emergencies, end quote. Well, does the Biden administration really think it has a case in court, or is it simply trying to keep up the pressure on businesses to carry out their dirty work? Here to talk more about this is Senator Roger Marshall of Kansas, who is a member of the Committee on Small Business and Entrepreneurship, a member of the Committee on Health, Education, Labor, and Pension, and is also a former business owner and physician. Dr. Marshall, welcome back to the program.
Tony, it's always great to be on with you. Good evening.
Well, Senator, you've been leading the effort there on the mandate in the Senate. Yesterday, all 50 senators signing a measure on the putting in process the Congressional Review Act on the mandate. But of course, now with this court decision, the Biden administration pushing pause. Is this the end of it, or are we going to see more of it?
Oh, no, Tony, your listeners need to double down with action now. All your listeners need to be reaching out to their senators, their Congress members, and saying we do not support this unconstitutional vaccine mandate. We're going to have to fight it on the land, on the air, in the sea, wherever we can. The Congressional Review Act is one such way. Another way is that we're going to be introducing an amendment to the continuing resolution to stop funding for OSHA to enforce this law. Tonight, we're introducing on the NDAA an amendment that would tell the White House they cannot give dishonorable discharges to service members who are declining the vaccination as well. So we have to keep fighting. This White House is not going to pay attention to the courts. The courts themselves describe this mandate as fatally flawed. They described it as using a sledgehammer, a one-size-fits-all approach to an issue which is obviously very complicated. So this is just, I think we drew first blood, but we got a long ways to go yet.
Well, Dr. Marshall, a lot to talk about here. This was one of three mandates. We've got the mandate, actually one of multiple mandates. We've got the mandate for federal workers. We've got a mandate for federal contractors. We have the mandate, as you made reference to, for the military. But then we also, one that I think is near and dear to you, we have a mandate that the administration has put in place for all medical institutions that are receiving Medicare and Medicaid funds. This covers about 17 million healthcare workers. What's going to happen with that? There are challenges, but is that one going to be stopped, or is it going to go forward?
Well, I'm afraid it's going forward. My phone is blowing up today from friends, family members who are in the healthcare profession, doctors I went to medical school with. These are smart people, and they don't want to get the vaccine. It's a personal choice. I support the vaccine. I've had the vaccine. My parents have had the vaccine, but I'm not sure it's right for my grandchildren who've already had the virus. But I'm afraid that they're going to be let go. It's happening in some states already. We are approaching another Congressional Review Act process that we're trying to stop it. But this is becoming a skins and shirts issue that my friends across the aisle typically support mandates, and my friends on my side of the aisle don't support mandates. But I'm afraid this one will be much harder to stop than the OSHA one will be. I think that everyone agrees with the courts that a federal vaccine mandate for everybody with more than 100 employees is unconstitutional, but it gets a little stickier when you start working with the military, with federal contracts, that type of issue.
So you heard at the intro of the show, I played a clip from Dr. Fauci yesterday, asked that, all right, when do we get to a point where we've got this thing under control? And he essentially says, we don't know, we'll know when we get there. How do you fight something when you don't know what success looks like?
Yeah, Tony, I'm just as frustrated as everybody is. I had a doctor when I moved to Great Bend. One of our first conversations, he said, once a doctor loses their reputation, they can never get it back. And I'm afraid Dr. Fauci's lost his reputation. I'm afraid this virus is going to be very much like the flu. We have epidemics of it at bad years, good years. We try to pick the right vaccine. I'm afraid people are going to need a booster shot every 6 months, the way it looks like to me, until we get a better vaccine. Unless, of course, you have natural immunity, and the CDC needs to accept the importance of natural immunity as well. So they're trading water over at the White House right now. The CDC's lost its credibility. It does feel like it's about control, doesn't it?
Well, let's talk a few numbers here. The CDC finally put back up on their website the number of infections, the cases that were reported, hospitalizations and deaths. And if I'm doing the math correctly, when you look at the number of cases that we've had in the United States and the number of deaths, just taking 2020, we had 375,000 deaths. I know that's obviously climbed since then. But when you do the math based upon all the infections, that's reported infections. Now, there's some that have not obviously been reported. We're talking about a mortality rate of less than about a half a percentage point, about 0.05%. When you look at the number one killer in America, it's heart disease. And we lost last year, in 2020, 659,000 people died from heart disease. A lot of that, this as a doctor, a lot of that preventable by diet, exercise, health, healthy living. The point I'm bringing up here, if they're able to mandate all of this action based upon a virus that has a 0.05% mortality rate, what's going to happen with heart disease? I mean, are we setting the stage for the government telling us we have to exercise, we can't have 32-ounce sodas? I mean, where does it stop?
Yeah, Tony, it is frustrating. This is why mandates don't work. This virus, I would suppose 90% of the people that have died over the age of 50, 80% over the age of 65, and a vast majority of the rest are people that are frankly overweight. Has the CDC spent any time on encouraging people to build their own natural immune system using the food that God has given us? Our own natural body's ability is the best way to fight a virus. So you're right. Which illnesses are they going to pick on next, right? And which scarlet letters are we going to have on our foreheads? And I just can't imagine forcing people to take a vaccine when you have an incidence of mortality probably 1/10 or 1/100th of what you described there if you're under the age of 30.
You mentioned the National Defense Authorization Act. This is a measure, annual bill. It's called a must-pass bill. It provides the funding for our nation's military. But like everything else coming out of Congress these days, the left has the lion's share of the drafting of it, and they put all of their things into this, and there's several bad provisions in this measure, one of them being forcing women to register for the draft for the first time in 100 years since we've had the selective service in place. Now, we haven't had a draft for nearly 50 years, but the selective service is still in place. You've been a part of leading the effort to try to get that out of the NDAA.
Right, Tony. Look, I'm all in favor of women volunteering to serve in the military. And there's just so many women that are doing an incredible job. But frankly, I don't want my daughter drafted or my future granddaughters drafted either. I just don't think that's a biblical principle. And, I'll leave it at that. Again, women in the military I'm okay with, but I just don't think it's a good idea to draft them. And
Right.
I'd love to pick your brain on that a little bit. And
Well,
I probably should.
Well, I am more than happy to have any of my daughters that want to serve in our military, and I've had those conversations with them. I'm proud of my service in the military. I'm proud to have served alongside of women who have served in the Marine Corps. And for those that want to go, God bless them. But I do not think we should be forcing our women, our daughters, to register for and be forced into the military. I think there's a bigger agenda here, Dr. Marshall. It's not about the military and everyone having the opportunity. Everybody has the opportunity. This is about blurring the lines of gender. This is about further deconstructing Western civilization is what this is about. It's a much bigger issue here than simply the draft and selective service.
Yeah, Tony, I think that's spot on. And I think that's where I ended up in my prayer time too, as I tried to sort that one out a little bit. And I think we agree completely.
Well, I know you've got a long night ahead. There's about 1,000 amendments waiting for the NDAA. It's going to take several days to get through them. I appreciate you taking time out to join us on Washington Watch tonight, and I want to commend you, especially as a freshman senator, leading the charge on so much of this mandate. I mean, you've got a lot of credibility with your colleagues there because of your past service, your position as a doctor, and we're just thankful that you're using that to protect freedom.
I'm humbled, Tony. I'm humbled that God has chosen me to serve him in this capacity, and we're going to keep fighting for Americans.
All right. And again, thanks for coming on today.